Hello, my name is Cindy Moore. At just 32 years of age, I was diagnosed with endothelial dysfunction. As a result of this dysfunction, I have experienced several heart episodes. In the days leading up to my first heart attack, I would feel dizzy, lightheaded, short of breath, and my heart would race. But these sensations were only temporary, and once they passed, I moved on with my day as normal. Nights weren't any better. Most evenings, I would wake up in pain, panicked, and disoriented. Like many, I was distracted. I had responsibilities, work, and bills. So I told myself I would deal with my health later. When I woke up the morning of my heart attack, I figured my pain would pass as it always had. But I was wrong. The pain continued to get worse. And as I raced to my bathroom, the pain became unbearable. Somewhere between trying to breathe and vomit, I passed out. My next memory is in the hospital receiving my diagnosis. And since then, I've experienced at least 6 more episodes. After a massive heart attack, I underwent a procedure to limit the damage to my heart and brain. And after I came out of my induced coma, I had to relearn how to walk and eat solid foods. I followed this procedure with a total of 5 more surgeries. In addition, my doctors tested various combinations of medications in the hopes of finding an effective combination to stabilize my condition. Lastly, in the hope of coordinating efforts between ambulance and hospital staff, a special care plan was put into place for me. This care plan would be executed when I arrived in an emergency state. Change has been rough. These days, life is about pills and planning. I can't even leave home without my pills. I can't vacation without my pills. I can't do anything without my pills. My advice for people is to pay attention to your body. Life gets busy, but your health doesn't care about your responsibilities, your chores, or duties. Ask for help when you need it and be proactive. Sincerely, Cindy Moore.
Hello, my name is Chad Moore. I'm Cindy's husband. Cindy and I met when we were both in college. We met through friends at a get-together and kind of hit it off pretty quickly. Her story starts randomly one morning where she basically woke up really early one morning, sweating really hot, had chest pain, felt confused, and found herself in our bathroom in the bathtub trying to cool off. This event woke me up, and I went to see what was the matter with her and asked her if she needed an ambulance. She said she didn't know, so I called 911.
I'm Sherry Bosch, so I'm an advanced practice nurse. I've been involved in Cindy's care since her very first presentation and cardiac arrest. So the first time I met Cindy, I was actually the supervisor of the cath lab. So the team came to me to ask me to speak with her family because she was on our cath lab table and had received CPR for a very prolonged period of time. So I quick went in to kind of see what the plan was or what was going on with Cindy at that time, and it was a little unclear what was happening, but it was clear by her images on her coronary angiogram that she was suffering significant coronary artery vasospasm. So what that means is that the coronary arteries that feed oxygen-rich blood to the heart were essentially spasming or collapsing, vasoconstricting so much that she didn't have blood flow to her heart, that would lead her to have a fatal arrhythmia and a cardiac arrest. So this was occurring. The team would provide CPR for prolonged periods of time. They would give different medications that would stabilize her, restore blood flow, and then the cycle would repeat.
So after that first experience, she spent some time in the hospital and started a regimen of medication and basically started a relationship with her cardiologist, Dr. Atai. The first couple episodes, I was pretty helpless other than calling emergency services because I didn't know CPR at that time. I didn't really know what to do. So it was scary.
So talked to Dr. Atai and a few other members of the care team and said, gosh, what can we do? What can we do to kind of get the message across to everyone from EMS to our ED for them to kind of know what does she need? Put together just a simple Word document, kind of talked about her background, kind of the events that were leading to where we were at, what she needed as far as care, which were just a few simple medications, and then contacted Area Ambulance to kind of give them the background. And of course, this was with permission from Cindy and her husband. And kind of let them know, this is what's going on, this is what she needs in her immediate treatment, and then also worked with the ED providers to make sure that we could find a way to put this in her medical record so that it was easily accessible.
So I took a CPR class, or did the CPR training here at St. Luke's, and not too long after that, had to put that training into action. There were times where the state that she was able to recover to after these events was helped by the CPR that I was able to do.
My name is Rose Hedges, and I work here at St. Luke's, and I'm one of our informaticists here, so I work primarily with the electronic health record and nurses and providers throughout the hospital. The hands-only CPR program that we started, Saving More Lives, really came into account when my coworker Sherry Bosch started working very closely with Cindy and Chad, and identified that Chad really needed to know how to do CPR because of Cindy's condition. So with our program, Saving More Lives, we offer it to our patients' family members while they're here in the hospital with us. So if a patient's had a heart attack or had something related that they could have damage to their heart, and we feel that their family members would benefit from knowing how to do CPR, we offer to them our hands-only CPR training.
I can't remember the exact number of different cardiac arrest episodes that she went through in the 2 years that she was going through all of this stuff, but there were a lot. And the last episode that happened to her was severe enough where her heart muscle just it couldn't recover on its own. So at a point in time, we had to decide that that enough was enough. And let her go.
I'm sure that was a tough decision to make.
Yeah, it was tough. It's very tough. Because she wasn't there. She wasn't there to help us make the decision. Cindy was an eternal optimist for the most part. She liked to laugh a lot. She liked to follow her heart and what she would do. So she would, where I would be more systematic and concrete, she was more abstract and free-spirited in terms of how she operated, which sometimes drove me crazy, but also created lots of adventures for us. She didn't really ever get down too much about anything in particular. The normal stresses of life, but she would always laugh it off. Very headstrong individual, for sure. She had a sense of humor through everything. She was very helpful and cooperative to all the medical staff, made their jobs a lot easier. they all fell in love with her and her attitude.
Because of Cindy, we learned that a simple care plan can impact and change someone's outcome in their care. Really kind of just talking about communication among the disciplines and what an impact that can have to have a multidisciplinary approach, kind of from A to Z. So from EMS, the first people that see her, all the way to the intensive care where they care for her. So, and all of the people that she would meet along the way, all of those people received education. I am who I am because of Cindy, for sure, and all the things that I learned along the way. But I think that, Cindy's legacy will go on for all of us.